Dear friends, welcome to episode number 21. I'm your host, Reda, and this is the Psyche and Human Body podcast. Today's guest comes to us all the way from Brazil. Her name is Liznara. Liznara is a physical therapist. Today, she will be discussing with us various topics related to physiotherapy, including the difference between Pilates and physiotherapy, the treatment and prevention of scoliosis, and the role of physiotherapy in enhancing athletic performance. I hope you enjoyed today's episode. Thank you very much for watching, and I'll see you in the future. Bye. All right.
Yes.
All right, Liznara, welcome to the show. Thank you so much for accepting the invite today. And just for starter, I would like to, if you please can introduce yourself for the audience. Who is Liznara? What's your experience? And let's go.
All right. So I'm Liznara. I'm a physical therapist all the way from Brazil, working and living here in the UAE since 2018. I've been working with physical therapy for more than 10 years, and I'm specialized in women's health and pelvic health rehabilitation. So my main interest of work is women in all their life stages, either pregnancy, postpartum, menopause, and I have a special interest in exercises during pregnancy. So my experience is based on that. I'm graduating in Brazil. I have a master's degree in biomedical sciences, and I'm also specialized in women's health and pelvic health. I really like Pilates. So I've done Pilates course, and I'm also a clinical Pilates instructor. So I try to add on my practice some Pilates-based exercises, which I think is very helpful. And that's pretty much it.
Super. You mentioned that you're taking like a Pilates course. So how is Pilates different from physiotherapy, or how are they complementary for each other?
Yeah. So the very interesting thing is that in Brazil, at least until I remember, Pilates is either done by physical educators or physical therapists. So you have to have some medical or exercise background to be able to attend the course and be able to teach. But all over the world, apparently you just have to do a course. So when it comes to the physical therapy, the Pilates, it's just like something that we can add in terms of exercises and education, in terms of posture, the right way of using the muscles, the right way of using your spine when it comes to exercises, when it comes to strength in the body. But physical therapy is way, way, way beyond. We have much more clinical and medical work rather than Pilates. So Pilates just complements my practice, especially when it comes to exercise and rehabilitation. But they're completely different things. But I would say it's either you're doing as fitness activity or you're doing as like part of your rehab. It's very, very helpful. So it's something that I really like to use with my patients.
Super, very nice. Liznara, can you please tell me what helped, let's say, motivated you to be into physiotherapy? Why physiotherapy and not other aspect in the medical system, let's say?
Yeah, so to be very honest, I never wanted to be in the medical. I personally have one thing called scoliosis, which is a deviation of the spine. It's not a big deal. It's not something that I needed to do surgery. But I was educated very young that exercise would be the solution, or they would help me to release my pain or to help with my pain, because I used to have a lot of back pain. So I started exercising, and I realized that I wanted to work with something that wouldn't be medical, but at the same time would be related to exercises or sports, but not necessarily being like a physical educator. I wanted to be a journalist, which has nothing to do with physical therapy. But when I was on my high school, I found out about physical therapy, and then I remember reading a book, and then I just realized that this is something that I want to do, because it's not 100% magical, because I won't be seeing blood maybe or this kind of things, but at the same time I'll be able to exercise and maybe rehabilitate people. So that was my main interest when I saw the books, and since I started working and studying, I just love what I do. I'm really passionate about physical therapy.
Beautiful. You mentioned scoliosis. Can you please tell us what is scoliosis basically? How do you define it? What is it?
Yeah, so scoliosis, it's a deviation of the spine. So the spine has three curvatures: the cervical spine, the thoracic spine, and the lumbar spine. So we expect the spine to be a little bit straight when you see the person from back to front. And then when you see the person from the side, you expect some of these curvatures, right? So when you have scoliosis, basically your spine is not straight from the back to front point of view, and it's going to be either deviated to the sides, that can be like C-shape, S-shape, and also the vertebrae will be rotated. So like a lot of people, they have scoliosis, to be honest, but we have a differentiation of what is like structural scoliosis, like it's a fixed bone position, and only like functional scoliosis. So let's say you've been sitting for a long time at work and you're probably using a lot of your right side. You can do maybe an X-ray and just see this scoliosis at this point, but it's not necessarily like a structure problem. It's just like one side of your muscles were so tight and the other one not that tight, so then the spine just changed the position. But when you have the structural one, which normally happens when you are like young, then you have the bone changed in terms of position and it's fixed. So the only way of correcting that is doing a surgery. But the surgery is only recommended for a very high degree of deviation. So not everybody needs a surgery. Most of the time, if you do exercises, your pain can go away and the spine will still be that way, right? You're not going to change the spine structure, but it's not going to be a problem. So there are certain degrees, I'm not very specialized in scoliosis, but there are certain degrees that you can just exercise and have no pain. A lot of people, they don't have symptoms, to be honest. So for me, I just found out about it because I was having back pain. So because the grade or the degree was not very high, the doctor said just do swimming or exercises, like,
and it's going to release
this is going to help your pain, and that's what happened to me.
I see. So like from what I understood, it could be like something which we are born with as children, and
that can be, but mostly you're gonna see at certain age, maybe around 10, 12 somehow. You can have like very small children with scoliosis. Normally, the time where you're gonna find out about it's around the 12 and above. And again, if it's like if you're over 18 years old or something like that, normally there is no much of options of treatments unless you do a surgery. But there are a lot of specific types of physiotherapy to correct or to minimize that growth on the position of the bone. So it can be corrected if you're young. And if it's not like a major degree, and then it really depends on person to person. But it can be corrected in certain cases. There are a lot of people with scoliosis, they don't know about it. So unless they have pain, then they go to the hospital, they do x-ray, and then they're like, oh, my spine is curved. And I was like, okay, your spine seems to be curved since ever. You know?
Since ever.
Yeah, since ever. But this is probably not the reason why you have pain right now. Because your body starts to create compensation. So muscles are going to be so smart that they'll try to work, just to make sure that nothing will be wrong. So your body will adapt to it if it's, again, not a big degree. But that's mainly it, like generally.
I see. Now, how can, for example, let's say you mentioned also that it could be like from our lifestyle, like it could be developed because we sit too much, for example, lean on one side to the other. From that, like, how can we fix it? Like, do we need just to release the tension of the muscle and that would do the job? Or is there some things which we need to do extra?
Yeah, so I guess nowadays we don't even call it scoliosis anymore. But if you come to the clinic and you say, I have back pain, I made x-ray, and then the spine is curved, and then we realize that this is not a real scoliosis. There are a lot of things we can do to help, but mainly the first thing we're going to do is to change the habit. So you're probably having this type of spasm in one side or tension in one side because of the way you were doing things. So the first correction is what we call ergonomics. So it's the way you sit, the way you use the computer, and probably the way you do exercises. After that, like trying to change a little bit the way you do things, we'll try to correct obviously the muscle tension. So if one side is very tight, we're going to do techniques to release that, and then try to stabilize these muscles and make them work in the same way. So most of the time, one side will be working differently. So one side is quite inhibit and the other side is super active. And then we're just going to try to balance out this and avoid this to happen again.
I see. So like it's good. It could be like fixable by time. Now something that crossed my mind right now. Could scoliosis happen? Like which part basically of the spine?
Any part of the spine. It's more common on thoracic and lower back, so mid and lower back, right? But it can happen any part. And it can happen all the parts too.
Oh, I see. That's interesting. I was reading once about scoliosis, and there's, I think, something that's called kyphosis, maybe.
Yeah, kyphosis. Yeah.
What is that?
So kyphosis actually is a curvature of the thoracic spine. So we have the lordosis, which is a C shape of the neck, right? Then we have the kyphosis, which is the curvature of the mid-back or the thoracic spine. And then we have lordosis, which is a curvature of the lower back.
I see.
So if you think about the spine like this shape, kyphosis is exactly the curvature of the mid-back. The thing is, some people, they have hyperkyphosis. So there is a lot of curvature in the mid-back, which can influence the way of your ribs, the way you breathe, and then it can give you a lot of pain. That can change a lot of your posture. You can become more like slouchy or like hunchback. So that's something that can happen related to muscle or joint or, spine specifically. But most of the times, again, in the like regular basis patients coming to the clinic, this is more like a postural problem.
And is it also like fixable, just like scoliosis?
Yeah. If it's like related just to muscle tension and poor posture, we can work well on that.
See. Beautiful. One thing that also now comes to mind, like physiotherapy, could it be a tool, let's say, to enhance the athletic performance of athletes? Could it be something that we can use before injury? And how can we do that?
Yeah, okay. So regarding athletic performance, we have 3 main points. The first one is prevention of injuries. The second one is the enhancement of activities or facilitating exercises or movements or performance. And the third one is rehabilitation or treatment of injuries, right? So if we think about an athlete or maybe a non-professional athlete, what we want to do is to maximize their performance. I'm just talking about non-professional athletes because that's what I see most of the times. So if you go to the gym a lot or if you do specific training very, very like often and then you ended up having some injuries because of that, it's very likely the physical therapy will prevent these injuries because we can assess like beforehand and then just make sure that you have the specific tools to prevent. So for me, for some physical therapists, but from my practice, I can see that a lot of people could have avoid a lot of injuries just because they had a specific prevention of their injury, or we call now Prehab. So it's like a term just to explain like the physical therapy that will happen before the injury to happen. So this is very common in like high impact sports, for example, and obviously in like professional athletes. If you just go through Olympic Games, you can see like everybody has a physical therapy sport, or they have the physical therapist team. But obviously they have all the they can afford that, right? As part of the sport. But like we're talking about non-professional, for example, people they cannot afford to have, for example, a fitness coach, a physical therapist, a functional doctor, medicine doctor, for example. But if you can afford, for example, having a physical therapist, you could definitely
invest in it.
Avoid a lot of injuries, or at least minimize those injuries, because some injuries will happen anyways, right? It depends on the sport you do, but most likely it will be less and less if you do physical therapy. So if we research a little bit on the literature, there is a lot of evidence that physical therapy can prevent a lot of injuries in different type of sports.
So, like, I mean, I think it's like a tool that we can keep in hand, even like, let's say, if we're not a professional athlete, but it could be like a preventative thing.
Yeah.
So it can prepare us, let's say, for what's going to happen next, for what's going to come next. So that's really nice, actually. But I mean, not a lot of people think of it as a way of prevention. They only think of it as a way of treatment, usually. Like, they only go to a physiotherapist when they get injured or have a problem with their body, then only then they're going to go. Like, they don't usually think about it as a preventative measure. Yeah,
because physical therapy is very much related to rehabilitation. So it's always like the second thing I'm going to do after I get injured. What I feel like is that nowadays people are getting more and more aware of this, which is good, but it's still far away of what we need. And understanding that, well, maybe I should see the physical therapist because I already have something that is bothering me on my shoulder or my back or my knee. And then what happened most of the time is that you have the injury and then you search for the physical therapy. And then, again, we could prevent that just doing a proper, like, education on strength, education on form. There is a huge problem that I see. It's that people go to the gym or CrossFit or any sort of sport without getting a specific orientation on how to start. Or they go to group classes where, like, unfortunately, the coach is not able to be individually taking care of everybody. It doesn't matter how much they take care, but they can really not be, like, specifically taking care of all the details. And these people start to enroll in sports that they will get injured, and then they don't have any sort of preparation for it. So I guess in that way, physical therapy would be very helpful as well. Like you want to go to a specific sport, you want to start running tomorrow, you want to start doing CrossFit. I mean, we're not going to tell you do this and do not do that, but we're definitely going to check and see which muscles you probably don't have strong enough that would be likely to injure during the sport. So I guess that would be very important if people understand that physical therapy is not only for rehab, but also for prevention.
Yeah, because as I mentioned, like say if a lot of people usually go to group exercises and the instructor would not be able to, let's say, specify on each individual.
Yeah.
And for the individual who is training, like via time, they're going to develop a habit which is wrong in the first place. So maybe going to physiotherapist from the beginning, like they're going to notice what are the weak muscles which they are not engaging, and via time, this could be, like, let's say, a source of an injury for them. So having it like early checked on could be like a solution for the future. I love it.
Yeah.
You told me that part of your expertise is also related to prehab and rehabilitation for women who are pregnant. And I was wondering, like, is there like some certain exercises or things which a pregnant woman can, let's say, take care as before pregnancy? Can we talk about this, please?
Yeah. So the first thing is to emphasize here, and thanks for giving the platform to that, because there is a big misconception about exercise on pregnancy. The first misconception is that exercise is harmful for you or for your baby. That's the main one. So we used to see in the past people saying like, oh, I don't exercise on my pregnancy because I'm supposed to rest, or I might have like a miscarriage, or it's not going to be good for my baby. So this is a very big misconception, which thanks God is changing. But again, we still see a lot of these cases where people are very scared. And the root of it, it's mainly because of the obstetricians and gynecologists are also not very well educated sometimes. And then they don't emphasize the importance of exercise in pregnancy. So there are a lot of things to take in consideration on pregnancy or pre-pregnancy. But the first thing is, exercise are going to be vital for the pregnant woman and for the child. So many things will happen during pregnancy when it comes to biomechanics. So your body will change in terms of position, because you're going to have like your uterus growing, moving your pelvis, moving your chest, moving your body forward, essentially. You're going to have like blood flow change. So you're going to have at least 50% extra blood flowing around your veins and arteries, which demands a lot of work for your muscles also to pump it back to the heart. You're going to have fatigue. Your muscles will start to be a little bit weaker in certain cases. You're going to have a lot of stretching of your ligaments. Everything will change, and then exercise are basically going to maintain the minimum we need to keep these muscles and this body healthy. What I would say in terms of exercise is that most of everything is fine on the pregnancy. The only thing that it's something that it really depends. Okay, so if you are an athlete, then we have to take in consideration that. But if you're not, we wouldn't recommend any high impact sports during the pregnancy, or anything which is going to keep you or the fetus in danger. So like skydiving or
I was going to ask
Yeah.
about that actually. Like, what kind of high impact sports can we do? Basically?
So I wouldn't recommend, for example, my patients to do running or CrossFit. But if they already have done that for a long time, so if they're runners or if they're doing CrossFit as part of their habit, we basically just adapt, but not as a new option of training.
I see.
I wouldn't start that for me or my patients.
Would that be because of, let's say, the heart is not used to this kind of training, or is it because of a muscle issue?
I guess it's a combination of many things. The first one, the heart is not used to it. Your muscles are not used to it. You have new adaptations on your biomechanics. And the third thing is that the risk of getting injured on like falling, for example. So CrossFit, you have a lot of jumping. If you're not jumping on the pregnant time, but you're still like stepping over a box, or you have, for example, the very high complex movements of a bar going around your chest and your belly, you can hurt yourself. So I wouldn't recommend anything like that. But if you were already doing CrossFit and you already have a good knowledge and experience, then you can definitely adapt. So that's mainly it. I would avoid high impact sports. And there is something very important to take in consideration as well, which is the management of the internal abdominal pressure. So just to clarify that, so the internal abdominal pressure is the pressure we have inside the internal organs in the abdomen during activities that we require high impact.
I see.
So when I jump, I increase my abdominal pressure. When I cough, when I sneeze, I increase my abdominal pressure. So during the pregnancy, this ligaments, muscle, fascia, tissues, everything will be a little bit more smooth and easy to stretch. So if I'm not able to manage that pressure, let's say I'm doing curl up or I'm doing jumping jacks, for example, I can increase the risk of developing a high diastasis recti. So diastasis recti is the famous gap of the abdominal muscles. I don't know if you ever heard about it.
I actually wanted to ask about it because like I once read about it, but I didn't know how does that happen usually.
I'll explain that in a minute. But also the internal abdominal pressure. It's very important for the control of your pelvic floor muscles. So if I have high internal abdominal pressure, my pelvic floor will need to do extra work. So just for like understanding, the pelvic floor muscles are the ones at the bottom of the pelvis, and they are mainly controlling the function of urination, defecation, postural changes. They're also related to the intercourse or sexual activity. They're also related to delivery a baby or not. So these muscles are at the bottom. They're a little bit more, let's say, fragile compared to the biceps or triceps or the quadriceps, but they're also skeletal muscles. So they also contract, relax the same way, right? So if I have a lot of internal abdominal pressure during pregnancy, or even out of pregnancy, but mainly under pregnancy, these muscles will need to do a lot of work, and they're not at their best time to do that. Other thing very important is that high impact sports, for example, can increase the risks of urinary incontinence and prolapse for athletes. So you can see, for example, CrossFit trainers or CrossFit athletes. You can see, I don't know if you have seen any video of women lifting weights and then licking urine. I don't know if you have seen that. So these sports can increase the risk of urinary incontinence and also prolapse of the organs, so organs falling down into the pelvis. But in the pregnancy, this risk just maximizes. So even if you're not an athlete, you still have the same risk of developing these issues related to the incontinence, or also your diastasis recti can be way bigger. So going back to your question regarding diastasis recti, so basically, if you think about the recti muscles, right, the abdominal recti muscles, we have one is like a connective tissue that makes the organs and the muscles to be back, right? So for example, for the recti, like the six packs, they look like that they're together. They're not connected 100%. They're not like muscle and muscle. It's one side and the other side. But there is a connective tissue that makes them close to each other. So during the pregnancy, especially after 34 weeks, this connective tissue will become a little bit more soft, and these muscles will separate. So they will be more side to side.
I see.
Everybody will have it. Everybody. All women will have it after 34 weeks. We also have cases where men can have diastasis recti.
I see.
Not really.
Is it because
not related to pregnancy, of course. Related to other factors such as, for example, weight gain, poor exercise routine, or poor exercise management, maybe smoking, or like poor habits. So these muscles, they separate, or they move side to side. And this is super common. Everybody will have it, but there is a good amount of the population that after having a child, these muscles, they don't go back to place.
They don't go back.
They don't go back.
Even if they train properly and try to...
it depends. So the main reason why they don't go back is not because the muscles are weak. Essentially, the muscles might be super strong, but it's because the connective tissue, which is that thing that connects the muscle or bring the muscles back to place, is not good. So you overstretch this ligament, this connective tissue. Sorry, not ligament. You probably don't have this connective tissue as strong as it was before. And then what happens is you go to exercises, and if you have a very bad management of your internal abdominal pressure, then this is not going to help much. It means you might exercise, and either this is going to get worse, or either it's not going to make any difference.
How to prevent it then?
So how to prevent? Learning how to activate your muscles correctly and breathe. So this is something that I would probably say to all my pregnant patients, irrespective of being or not active during the pregnancy, is just to manage the abdominal pressure. So one good example is when you are lifting weights, rather than exhaling, you can do like a strain.
So keep the pressure.
So it keeps the pressure inside, or it increases the pressure, right? Obviously, if you are like a power lifter, or if you are like a CrossFit athlete, you're going to have a specific mechanism to help yourself to lift something very heavy. So I'm not going to go into that detail because this is very specific for athletes. But for the general population, a very good way to make sure you're not increasing the abdominal pressure is making sure that you're not straining when you do the lift. So for example, I'm doing a deadlift. It's very bad if I go and just strain and I don't allow the air to go out, or I just bulge my tummy outside, or I push my pelvic organs down. So the ideal thing to do is to engage all and be able to breathe at the same time. It's a very easy way, I mean. But we're not doing that in the gym most of the times. We're just holding the breath as we bench or as we squeeze the muscles. And for women, this is really, really harmful in pregnancy.
You mentioned about powerlifters and trainers and how do they keep the pressure down. I see them usually, I usually see them where they hold the pressure heavily and they try to expand intra-abdominal pressure. Could that be a reason for, let's say, tearing the line between the two abdominal muscles?
Yeah, for the power lifters and for like heavy lifters, that's another mechanism they need to use. Because if they don't use that mechanism, some of them, they can pass out during the lift, or they won't be able to do the management of the weight, right? It's not very common to see it in athletes, the diastasis recti. It's more common to see in people who are not exercising, or people who are like very bad in terms of form in the gym. So these people can have, for example, the incontinence for women most of the times, but not the diastasis recti. You don't see them very often, I would say, or at least I haven't seen any. But I would see it very often, for example, for people which are just going to the gym, not exercising correctly, and either they're pregnant or they were pregnant recently, and also for men when they don't really know how to exercise or to breathe. So there are all the things that we're not very sure about. To be honest, it's still very unclear, like certain reasons why you have these muscles separating a lot. But the main thing we know right now, and this is changing because over and over, the studies are trying to identify exactly the reason and how to treat. We still don't have like a gold standard treatment for that. There are a lot of people saying they can fix diastasis recti, they can rehab diastasis recti, but we don't have like one type of therapy that is for everybody. I see. But the main reason is just the poor management of the abdominal pressure. So this is something, if you learn how to manage during training, you're likely to have less risks to develop a huge diastasis. Because for female, again, after 34 weeks, everybody will have, and that's very expected.
I see. Now, I have a question actually, which goes as the following. Many athletes, let's say people who usually lift heavy weights, develop a very tight pelvis floor. And the question is, like, are they connected, like the abdominal muscles with the pelvis floor somehow?
Yeah.
Because usually, even if they don't, let's say, do a specific training for the pelvis floor, it usually gets super tight. So how are they connected, like, let's say, the abdominal muscles with the pelvis floor?
Yeah, so just for you to understand, basically, the pelvic floor works either isolated or in combination with other muscles. So on a day-to-day activity, we don't have the pelvic floor working isolated. It works together with abdominal muscles and with the spinal muscles, specifically one multifidi muscle for the spine, right? Which is a muscle that helps to stabilize your spine in certain positions. So when you work a lot on abdominal muscles or back muscles, I cannot say that this is going to cause pelvic floor tension, but if you have pelvic floor tension together with like any sort of back pain or abdominal tension as well, these muscles will be tense all the time. You need to activate them. So you're probably just working them too much. And that's why there is a connection, right? Now, if we think about the pelvic floor, a lot of people say, like, you have to strengthen your pelvic floor, you have to strengthen your pelvic floor. Not necessarily, right? So I always give the example of the bodybuilder who has very big volume on the biceps, and they cannot stretch the arm 100%, right? They have a nice volume here, but they're not able to stretch.
Because it's very tight, basically.
Because it's short, right? The muscle, the volume of the muscle is big, so then it's very short. So for the pelvic floor, it's a little bit different, because if you have this muscle super, super tight, you might have problems on the urinary and your bowel function.
I see.
Because that muscle, that group of muscle, is not only a skeletal muscle which makes contraction and relaxation just for the matter of doing it, but also because these muscles are able to help you to pass things on the toilet. So if I have a tight pelvic floor, I might have difficulty to empty my bladder, for example, or difficulty to empty my bowels.
I see.
And then that's why it's important to make sure the muscle is functional. So strength is not our main work in pelvic floor. Our main work in pelvic floor is functionality. So it's a muscle that can contract when I need. So I need, for example, to hold my urine. I am lifting a very heavy weight and I don't want anything to pass without my intention. But at the same time, I need the muscle to be relaxed because I don't need to squeeze my muscles all the time. They don't have to be activated all the time unless I have full bladder, full rectum, or maybe I'm doing a heavy weight lift and then my body doesn't allow anything to go out. So they are literally connected in terms of function, 100%. A maximum pelvic floor contraction, for example, will activate your abdominal muscles together. So they are 100% connected. And if they are overloaded in one point or over tight in one point, it will affect your whole thing as well, like the whole back and abdominal function.
I see. And how can we know, for example, if it's overly tight or overly loose? Like, how can we know the sweet spot for functionality?
We have some signs. Obviously, the best way is assessing the pelvic floor with a physical therapist.
Okay.
We have some signs of, for example, tension. So let's say you have a very simple one. When you are standing, you are like squeezing your butt.
Oh, okay.
Some people, they're just squeezing the butt all the time when they're standing, right? Or this is a sign of tightness, for example. Another one, it's, for example, you are leaning in one side. You're putting all the weight in one side of your hip. So you're standing and you just shift all the way to one side. That can be a sign of tightness. That can be a sign of weakness, for example. Pain is a sign of tightness most of the times. But weakness, it's more likely you are not able to hold the urine. For example, when you cough, sneeze, laugh, jump, sometimes you have urgency of urination. So you have to run to the toilet every time your bladder is full. Or maybe you have high frequency of urination. So you go every half an hour to the toilet. But it's funny and interesting at the same time because that can be tight and weak together. Okay.
Oh, really?
So this is something that it's usually like mind-blowing for people when I say, I'm like, your muscle's tight and weak. And the idea is like, but my muscle's tight, supposed to be strong, right? But strength and tightness are something completely different, right? So I can have a very strong trapezius here, and that can be very tight. So I have a strong muscle, which means I can do everything I need in terms of function, so I can lift the muscle, the weight, I can use my arm in all directions, and that's fine. But I can have a strong muscle that can be tight. It means when I press, I cannot handle the palpation, it's very painful, or whatever I do when my shoulder hurts, my neck or my trapezius, that can be weak and tight. So tightness is more about the tension on the muscle. In terms of I can handle a movement or not. Strength is all about the capacity of the muscle to do a movement, right? To contract. So that can be tight and weak. That can be tight and strong. Most of the times it's tight and weak. Most of the time, because if my muscle is very, very strong, usually I can use the muscle better. But if my muscle is very weak, I need to do a lot of work for that muscle to function, and I end up creating tension.
I see.
So I know it's a little confusing.
Because I actually just thought, like, how is it that the muscle could be tight if it's not strong? So, like, let's define tightness. How can a muscle be tight, basically?
Okay, let's give you an example. You know, when you go to the gym, and I'm just trying to make it very simple. You go to the gym and then you never exercised before, right? And then you go to the gym and then you exercise, and the next day you have all this lactic
acid.
And then and then you barely can touch the muscle. And then some people, they will have a lot of pain, for example. Then you touch the muscle and you feel like the muscle like hard, and you can feel like trigger points, you know, those little points of tension. This is more related to tightness. Okay, so the tightness can happen in any muscle. That can be a strong muscle, weak muscle. But most of the time it's going to happen in a very weak muscle. For example, if you overtrain, you can feel tightness, right? I have very strong delts here. I have very strong shoulder. But when I overtrain, I just had to do a lot of training this week, or I had a competition, then I can literally do not move my arm because my muscles are very tight. So tightness is more about how do I feel the muscle, right? And the strength is more about the function of the muscle.
I see.
I guess this is a little bit easier too.
This is how you explained it a bit, like, because now I have like an idea. Because as you mentioned, like, even if you're a new beginner in the gym, you started training, you're still not strong, basically.
Yeah.
But you're still going to feel the tightness, which is this is how we can separate between strength and tightness.
Yeah.
Beautiful. I need to go back for the pregnancy thing, the pregnancy matter, sorry.
Yeah.
How does the pelvic floor changes within pregnancy? And how can we, let's say, take care of the pelvic floor within the pregnancy before and after?
Yeah. So the major thing is the hormonal change, I would say, which makes the muscles a little bit more soft. So that's the first. The second one, it's because if you consider that these muscles are in a position that they don't have anything like under the muscle, so the muscle is in a fragile position, let's say, right at the bottom. We're going to have the uterus growing a lot, and then obviously your fetus or your baby will grow, your chest will become bigger, your body will be bigger in general, you're going to probably gain weight, you have the amniotic fluids. So this is going to be super heavy on the muscle. So that muscle, which usually was holding, I don't know, 50 kilograms, now it's going to hold 100 kilograms, or whatever tension and weight, it will be over the muscle. So the muscle will be already being influenced by the hormones, which are going to allow the muscle to be a little bit more flexible and stretch a bit more. Second, we have the weight on top of it. Third, it's going to be more difficult for you to manage the abdominal pressure or all the type of gravity going into the muscle. And the last thing is that your bones are also going to change. So your pelvis will start to become a little bit more wider. So then it can accommodate the baby properly inside the pelvis, and then you can have the baby, right? How we can prevent or minimize injuries, definitely working on the pelvic floor. So during the pregnancy, I would recommend everybody to exercise from the beginning to the end, not only specific pelvic floor exercise, but general exercises, which works on your glutes, on your abdomen, on your back, and then make sure that these muscles are going to be strong as much as possible during the first, second trimester. And towards the last trimester, which is the last weeks of pregnancy, the focus is to keep more the mobility. So we want to make sure the pelvis will be moving well, you want to be able to have all the range of movement around your hips and your back, and then facilitate the muscle to stretch. Because again, if I have a tight muscle, and we go back to it, and I want to deliver my baby naturally, I need this muscle to be relaxed, right? I don't want this muscle to be so tense that I cannot stretch the muscle enough. So physical therapy is my key for making the muscle strong on pregnancy and after pregnancy. Now, if we focus on after pregnancy, we have many things to consider. The first thing is that we can have the vaginal birth and the C-section. When it comes to risks of pelvic floor dysfunctions, the pregnancy is the main risk. So some people will say, oh, I'll have a C-section, so nothing will happen to my pelvic floor. That's not true. You can maybe prevent laceration of the muscle, tear of the muscle, because obviously your baby won't pass through the vagina canal, but it doesn't mean you're not going to have any pelvic floor dysfunction. Because the major risk for pelvic floor dysfunctions is the pregnancy. And obviously the vaginal birth can increase the risks of certain specific dysfunctions related to the laceration, or maybe a prolapse, let's say a little bit more than the C-section, but still it's going to be the same risk for both of them, whoever have a C-section, whoever have a vaginal birth. And the C-section, in contrary, can also give a lot of problems related to the scar and the abdominal management, because you had like a major scar that will go through all the layers until it gets up to your uterus. So that can be as risky as having like a vaginal birth in terms of later dysfunctions.
I see. As you mentioned, it's like a misconception between the people, like the C-section and delivering it naturally, let's say. I didn't know that actually before. So now, speaking of the pelvis floor tightness and strengthening it, like I read once about something called the Kegel method for pelvis strengthening. Can you please tell us what is that, and is it beneficial? Can everyone use it, or what is it basically?
Yeah, so Kegels are the main name you're going to find around the internet when it comes to pelvic floor training. But Kegels are like a very old school way of talking about pelvic floor training.
I see.
So we like to say pelvic floor training because we now know that we need to keep muscle functional rather than only strong. But Kegels are basically contractions of the pelvic floor, like random contractions of the pelvic floor. So you don't ask your client or your patient to go to the gym and do random exercises, do you?
True.
There is a plan, right? You have to assess and see what is the ability of your client or patient to do something. And then you actually have to tailor the exercises to that person. So Kegels are just the common name for pelvic floor squeezes or pelvic floor contractions. We don't use that in the physical therapy as like our terminology. We usually say pelvic floor training, but it's basically the training of the muscles, right? So I don't like the Kegels just because of that, because you're going to go to the internet and they'll say, oh, you squeeze your muscles 100 times a day, 200 times a day. You don't do 200 squats a day, and you don't do that every day, right? Your muscle needs time to rest. Your muscle needs time to get flexibility. So it's better just called pelvic floor training, and then obviously this is going to help your pelvic floor to be healthy and strong and functional. And the best way is always seeing a physical therapist for that. So I don't recommend people to randomly do Kegels because, for example, they can increase tension of the pelvic floor, right? So let's say, I'm going to put a very simple example. A person that has high frequency of urination, and she's going to the toilet or he's going to the toilet every half an hour. For example, they have urgency, so when the bladder is full, they have to go quickly. They sit for most of their day, so they already have signs of tension of the pelvic floor. And if I ask them to keep squeezing a muscle which is already tight, they might have worse symptoms. So that's why I don't recommend Kegels, as you can see easily in the internet. I always tell them first, have a physical therapy assessment, just make sure you go through the physical examination, you explain all your symptoms, we review all the history, your habits, and then this is more likely to help.
Actually, a lot of people over here, not only over here, like around the world, strengthening the pelvic floor is like an automatic thing that comes to their mind, and they go to the internet and they just Google it, and their Kegel is going to pop up for them, and everyone's going to go for it, and without knowing the consequences. Because as you mentioned just now, like the pelvic floor doesn't have to be strong or weak. It's a functional muscle, basically.
Yeah.
It just have to function properly. It doesn't have to be strong or weak. And I think because of the over-information on the internet, that people fall into the trap of thinking that they are doing the right thing. However, they're falling into the trap of doing the wrong thing, basically, which is
what I feel like is that internet has helped us a lot as a physical therapists, because I see a lot of people who comes to me just because they found out some information on the internet, which is a good side of internet. We're here able to today talk and maybe display that in the media because we have internet. But at the same time, there is a lot of false information or wrong information. And unfortunately, it's something that we have to wait for the time to pass and this information to vanish and something new and update starts coming up. But we do have people which comes because they were doing Kegels by themselves, and obviously we're just talking about the superficial thing of it, but working in a clinical setting, you're going to see major problems related to the pelvic floor. Like major problems where people cannot literally work because of their pain, especially when it comes to like defecation issues, so bowel problems. That's very sensitive. The fact that if you keep squeezing these muscles, they will be very tight and you're not going to be able to use the toilet correctly, and then your life will start to become miserable, and then you might have, for example, super easy to say, if your bowels are not working well and you have, for example, difficulty on going to the toilet, you can have hemorrhoids, right? And then you're going to have a surgery for the hemorrhoids. And if the surgery doesn't go well, you're going to develop a problem from the surgery. And then it's a cascade of problems. And then they will go to the internet and just try to do anything to help them. And unfortunately, they just make things worse. So those are obviously chronic cases, people which are having problems for more than 3, 6, 5, 10 years. But in that case, the internet doesn't help much because they will never know what to do and they will just search whatever is available, right? But I guess hopefully, like with the news, the new changes on the internet, like we have more people aware what is like correct and wrong for the things we read. So every time you, for example, open a video, a lot of people will be commenting, this is not like that, so I guess this is gonna at some point just sharp a bit more what we have in terms of internet information. But for now, unfortunately, we still have a lot of these problems.
I think time by time, we are filtering out, let's say, the wrong information. because it's getting narrower and narrower. Like when the internet first started, when everyone started going out and talking, like you started seeing people who have no idea what they're talking about, like no background, no knowledge, no experience. And they're just going out and speaking on behalf of doctors and spreading information to their followers, and their followers just are following it because they have no idea, because they think that it's the correct thing. So I think via time, like filtering the information is becoming something coming to us all, like in the near future.
And what I feel like it's important as well as a patient or client, or if you are looking for a service, please investigate who is going to provide you the service. In physical therapy, we have so many specialties as we have in the medicine. So you have the gastroenterology, you have the gynecologist, you have the cardiologist. So physical therapy is not very different. We have the general physical therapist, which can do like a general assessment treatment for like not very complicated cases. But we do have people which are specialized in sports, in pelvic floor rehabilitation, in neurological rehabilitation. So the best thing to do is always do a little research, you know, for whatever professional you're looking for. And if you're getting like information from the internet, make sure you check with your healthcare provider. I always saw like everybody, we're here now talking about like physical problems. We're not giving any advice on treatment unless you see the professional. You know, if, for example, I'm not telling anyone to do pelvic floor exercises unless they see a physical therapist first, and then just do the assessment, as we don't recommend people to start exercising without any knowledge. So research and education is something that is really important.
How can we differentiate, or how can the audience differentiate between like a good or a bad therapist? Because some therapists out there also do mistakes, and it gets the customer or the injured person or the athlete into a loop. So how can they know? How can they differentiate? Because sometimes it gets just like getting information over the internet. It's over information. They just have to believe and go with it.
Yeah.
So how can we differentiate, for example?
It's a good question. Puts me in a very delicate situation. But I can tell you, like, as a patient, for example, I can say that if you go to a physical therapist and they promise you that they will fix you, that's something I would probably...
Red flag.
Yeah, I would probably like, because we don't fix things as a physical therapist. We facilitate things for you. So we cannot be entitled to fix things because there are other things. So you come to the physical therapy, you probably see a therapist for, I don't know, 45 minutes once a week. I'm not able to tell what this person is doing throughout the whole other time. So she's like, oh, I have back pain, and then I don't do anything wrong, and then but then she's at home like sitting all the way around, or she is lifting wrong, or she, I don't know, she has poor habits. And so the first thing for me is we cannot fix anything. The second thing is there is no one type of therapy that fixes all the problems. So if you go to a physical therapist and they promise that, oh, we have this equipment and this equipment will fix your shoulder, fix your pelvic floor issue, that's a red flag, because every person needs a specific treatment, and everybody will need like a very comprehensive approach for us to decide. For you, I might treat you in a way. For another person that has the same problem, I'll probably treat in another way. And the last thing probably I would say, if the therapist is very passive approach, so what is passive and active approach? So you probably have seen physical therapists which they have a lot of equipment. They have like electrical stimulation, they have ultrasound, they have fancy equipment which are fantastic, and I guess if you have the chance to have it in your clinic and provide it to your patient, that's very good. But there is no rehabilitation in physical therapy that only the therapist is doing the work. You need to be the main person doing the work as a patient. So I can provide you like manual therapy and do a little bit of release on your neck, muscles. But if you don't do the things that I am advising to do, exercises, stretches, changes on your habits, this is not going to probably fix the problem or help the problem. So those are the main red flags I would probably say. When it comes to pelvic floor specifically, I need to highlight that we need extensive education to be pelvic floor rehabilitation therapists. And all over the world, I see people that they do a course on the weekend and they call themselves like a pelvic floor physiotherapist. So it's better if you really talk to the person, to the therapist, and maybe do a little bit of reading on their background, because it takes a lot of time for us to be specialized or to be educated enough to rehabilitate pelvic floor, because it's a complex area of the body. And that's the main red flags I would probably
Beautiful.
say.
Yeah, beautiful. Like, because everybody at a point in time they need to fall into being the customer or being the patient. Like
Yeah.
you, me, even doctor, like anyone is gonna. So they need to know how to differentiate between a good or a bad physician, basically. Because out there are amazing physicians and there are also some not very good physicians. So they need to be able to differentiate, just like
Yeah.
their promotion over the internet. So some of them are good, some of them are not really good. So yeah, I see your point. Beautiful. Liznara, is there anything that you'd like to add up on today's conversation? Any closing notes which you would like to share with the audience?
Yeah, so just want to thank you first,
You are
and
most welcome.
Juliana, for
Sure,
inviting
most
me.
welcome.
I'm very passionate about talking on any aspects of women's health, pelvic health. What I would say, it's probably for women,
Sure.
but also applies for men. If you have pelvic pain,
Mhm.
if you have any sort of issues on using the toilet, either for urination, defecation, or anything related to that, make sure that you get like proper information from your doctor, but you also search for a physical therapist. I guess now it's getting better and better. The doctors are aware that when they clear all the tests and the patient still have a complaint, they can always consider a physical therapy as one of the treatment options. But if you do struggle with one of those things, please search for a physical therapist, because sometimes you don't really find the space to talk about it, or you're very embarrassed about talking of anything related to your intimate area.
Very true.
So we are very educated, specialized, and we're going to for sure do a very comprehensive assessment to understand what is happening. And if we're not able to treat, we're going to definitely recommend you to go for someone who can do that. So that's it. Just take care of your health, take care of your pelvis. And if you don't know what to do, search for a physical therapist.
Beautiful.
Thank
you so much, Liznara, for
very
coming
much.
in. It's been a pleasure having you on the show. I want to thank you again for accepting the invite. And I wish you all the best for you, your family, and nothing but happiness.
Thank you very much.
Thank you so
and
much.
Good luck with the podcast.
Thank you so much.
Thank you.